What can a hysteroscopy find about your fertility? Imagine peering inside your uterus without making a big incision. That's what a hysteroscopy does. It's a minimally invasive procedure that lets doctors see directly into the uterine cavity. This is especially helpful when trying to understand why conception might be difficult. Many women with unexplained infertility or those who have had unsuccessful fertility treatments find this procedure revealing. During a hysteroscopy, a thin, lighted tube called a hysteroscope is inserted through the vagina and cervix into the uterus. It allows the doctor to look for common issues that could be blocking or damaging the uterine environment. For example, uterine polyps are benign growths of the lining that can interfere with embryo implantation. Removing these polyps during hysteroscopy can improve chances of pregnancy. Another common finding is uterine fibroids, which are non-cancerous muscle tumors inside the uterine wall. If these fibroids are located just beneath the lining, they can distort the cavity or block the fallopian tubes, making it harder for an embryo to implant. Hysteroscopy can identify and remove these fibroids, helping restore normal uterine shape. Scar tissue inside the uterus, known as intrauterine adhesions or Asherman's syndrome, can develop after surgeries or infections. These adhesions can prevent the uterine lining from developing properly, leading to infertility or miscarriage. Hysteroscopy allows the doctor to cut and remove these scars, improving the uterine environment for pregnancy. Congenital uterine anomalies, like a septum or a partition dividing the uterine cavity, are also detectable. These structural issues can cause recurrent pregnancy loss or infertility. Hysteroscopy not only diagnoses these abnormalities but also enables surgical correction, such as septum resection, which can significantly improve fertility outcomes. Chronic endometriosis, or persistent inflammation of the uterine lining often caused by infection, can impair embryo implantation. During hysteroscopy, signs of inflammation can be observed, and tissue biopsies can be taken for further testing. Treating this inflammation can enhance the chances of a successful pregnancy. Rarely, hysteroscopy might reveal precancerous changes or signs of inflammation related to endometriosis, affecting the uterine lining. While endometriosis primarily affects the pelvic cavity, hysteroscopy helps rule out or treat uterine factors that could be contributing to infertility. Importantly, hysteroscopy often allows for treatment at the same time as diagnosis. Removing polyps, fibroids, or adhesions during the procedure can directly improve the uterine environment. This can lead to better embryo implantation and a higher chance of pregnancy. In cases where endometriosis is involved, hysteroscopy is a useful tool to evaluate uterine health. While endometriosis mainly affects the ovaries and pelvic tissues, it can sometimes cause inflammation or abnormalities inside the uterus that hinder fertility. Addressing these issues can be a key part of a comprehensive fertility plan. Research shows that women who undergo hysteroscopy before fertility treatments like in vitro fertilization often have higher pregnancy and live birth rates. It is considered a gold standard for detecting intrauterine problems that other imaging tests might miss. The procedure is generally safe when performed by experienced specialists, with minimal risks and quick recovery times. In summary, hysteroscopy can find and often treat conditions inside the uterus that may be blocking or damaging the environment needed for conception. It plays a vital role in fertility assessments, especially for women with unexplained infertility or endometriosis. By restoring a healthy uterine environment, hysteroscopy can help improve the chances of successful pregnancy. Always consult with a fertility specialist to see if this procedure is right for you and to develop a personalized treatment plan based on your unique needs.